Good afternoon. I'm Serena Naylor, Board Chair with Mosaic Life Care Board of Trustees, and we welcome you to this press conference to officially welcome Mike Poore, Interim CEO, on his first day with Mosaic. Before I introduce Mike, as he likes to be called, I would like to thank our tremendous physicians and caregivers that continue to provide remarkable patient care every single day under all circumstances. I'd also like to thank our wonderful leadership team that continued normal operations during this transition leadership period. All our caregivers have provided a seamless transition for Mike, and we are honored by their dedicated service to all of our communities. Now, I would like to introduce to you Mike Poore, our temporary CEO, and let you know a little about his background. Mike just finished a term as Interim Chief Executive Officer for a health system in Virginia. He has served as Interim CEO for numerous health systems across the nation through LifePoint Health, a diversified health care delivery network. Mike has more than 20 years of experience as a CEO and more than 30 years experience in healthcare. He grew up in Alabama. Mike and his wife Penny have 3 grown children. His role with Mosaic in this temporary position is to listen, assess, and provide guidance for caregivers while a permanent CEO search continues. And now it's my pleasure to introduce Mr. Mike Poore. Mike?
Thank you, Serena. I really appreciate that introduction. Move the mic so everybody can hear us. So I'm very excited about joining Mosaic Life Care. This is an amazing organization. In the last couple of weeks, I have been learning as much as I can about the organization and the great work that's been done here. As many people know, the last 2 years have been tremendous strain on healthcare at every level. And so I am just excited to be here and be a part of this team going forward. One of the things that I tell people in situations like this with an interim is that I want to be boringly consistent, that we're having consistent quality, consistent care, consistent customer service for our patients. And I'm excited to be working side by side with the team here to make sure that we do that. I do have a lot of experience. At one time, I was a division vice president and had 22 hospitals over 5 states, actually 4 hospitals in Missouri at one time. But I also, with that experience, 30 plus years, I understand that every hospital is different. The culture is different, the community is different, the needs are different. So I'm really on my learning tour right now, meeting with everybody and learning all I can about the care that these great providers and leaders have given here. And I'll meet with our physician providers and our hospital staff too. It's been a full day getting to meet everybody and putting names with faces, and especially hard when we all have masks on. But I'll learn, and I'm very excited about being a part of this. Healthcare is very personal, and it's personal to me too. I have a son who is 30 years old, who was born with a birth defect, and he was in the hospital a lot. He had more than 25 surgeries in his lifetime, and I got to see from the other side of the bed, as a consumer of healthcare, how important it is that what we do on a daily basis. So I'm very focused on quality of care, on patient safety, and how we can support our teams as they give that care on a daily basis. So with that being said, I wanted to open it up for any questions that you may have, and we can go from there.
This may be a question for both, but I think maybe the public CEO is what the focus of an interim CEO is.
Well, that's actually a really good question. And so the way I describe it, again, is being boringly consistent, to continue the good work that's already been going on here, to support the team through this transition. A transition can be a time of high anxiety. Change is never fun, and especially what we've gone through in the last 2 years in healthcare with COVID, that anxiety, that rate of change has been tremendous. So what I do is I'm a good shepherd. I shepherd the team through a transition to a permanent CEO. I bring a lot of experience to the table that I can lend to the team and make things happen. But at the same time, I'm not here to change a lot of things that are going on as they are. This team has done a fantastic job in the transition, and I expect that to continue, and that I'm going to support them through that change.
Could you address that?
I think we're really lucky to have someone of Mike's caliber step in this role at this time. He came with, when I talked to people with his references, they were all like, "Oh my gosh, you're so lucky to have somebody like Mike." And we were just so thrilled that he's going to be here. And we've got such a great leadership team in place, and he'll be here to help guide them. And it's a really exciting time for us.
But what do you foresee his role to be?
I think just like what Mike said, that he will be a shepherd, and he will go around and he'll talk to people and get their feel for the organization and see their strengths and help us assess what we have here already in place.
Kind of going off of that, what is your message to staff that have gone through some hardship over the past couple of years?
Well, my message is that I'm keenly aware of the kind of stress and strain that the team has gone through, and my job is to take care of the people who take care of people, take care of our patients. And so I'm very focused. I've been reading as much as I can about what we can do for resiliency for our teams, because I think that's probably our number one concern today in healthcare. There have been a lot of good people who've left healthcare because of the stress and the strain. And we want to continue to support our teams and make this the best place in the world to give that care to our patients. This team, and I've done my homework on the results that they've put forward during this crisis, this pandemic. I believe we're past it. My crystal ball is no clearer than anybody else's. I think we're moving to endemic instead of pandemic, but we still need to be able to support those teams. So no major changes. When I talk to my team, I tell them that, again, that boringly consistent. The other thing that I always tell people is I'm impeccable with my word. I try to live and do everything that I say I'm going to do. And when I'm wrong, I'll correct it and we'll move forward. But no one will work any harder. I will give my best to this organization. So I'm, like I said, just very excited to be here. It's a great hospital. It's a great team. It is a jewel in the community, and I've been here 24 hours now, finding my way around. But the hospitality, even going to the grocery store, everybody has been great, and I'm excited about being a part of the team here.
You've had interim kind of this position in the past, as that was talked about in your introduction, but obviously you've only been here 24 hours, like you said. But what do you think are some challenges that are maybe unique to Mosaic that maybe would be different to a different stop that you've had in the past? And I guess here in the early going, what are some things that you're looking to address at first?
So in a lot of the other places that I've been in, there have been specific issues that I needed to tackle. A certain issue at the hospital that it wasn't doing as well as it needs to. What I can tell within my 24 hours is that Mosaic isn't one of those. There are no burning platforms. I've interviewed all of the senior leadership team. I spent a couple of hours on the phone with folks, and even some of the leadership, like Dr. Turner, who's left. I got all the advice I could from him. Spent 3 hours with him on the phone, and there's really no burning platform. This is a good hospital. It's a great team, and that's nice to have when you're a CEO. So I'm excited about, let's continue the strategic plan that we have and executing on that. We've got a big challenge in the next year to change to a new hospital information system, to Epic, and that's going to be a major undertaking for our hospital. And I want to make sure that we've got all of the planning and all of the resources needed to make sure that that happens in the future. So again, I just want to get in the same cadence with this team and march forward.
What do you think needs to be done as the CEO search is being conducted to ensure that whoever is hired for the permanent CEO has the best, I guess, hospital to take over and run? Kind of how do you feed into that transition of looking to the next leadership at Mosaic?
Well, it goes back to what I said about being a good shepherd. If I'm a good shepherd and that I am making sure that our resources are used in an appropriate manner and that we're keeping all of our strategic plans in place, then I can easily hand it off to the next person to take over and let them continue for the future. So, that I know I keep on going back to boringly consistent, but that should be our theme. I've worked in other situations where there has been turmoil and those kind of things, and my goal there was boringly consistent. How do I make things not so tumultuous? And I have been able to do that. I know it doesn't sell newspapers or radio or TV, but that's what I like to do, and I've made a career doing that.
Serena, could you address just the search for a new CEO and tell us, how long you think this interim situation and when you hope to have a new CEO?
We've already received so much interest in the new CEO position, as I knew we would. When you've got an outstanding organization like Mosaic with a really strong balance sheet and wonderful physicians and caregivers, you're going to attract the best, and that's what we've been doing. And we're really excited about this list so far that we've already received. We're hoping to have some kind of announcement by early summer, but with good laid plans. But that's our goal, is to have someone announced by the summer, and then hopefully have the new person in position by the fall. That's what we're hoping for, but you never know. But we're really excited. The process is, I knew it'd be great, but it's really great so far.
Can you address the transition? Why you haven't been able to speak with anybody on the board? Why did the board believe a new leader was necessary?
There were several reasons why, and we just feel like we need the best possible outcomes for our caregivers and our physicians, and we had to make those choices, and that's what we did.
A lot of rumors flying around the community. Is there any specific reason why Mark Laney was let go, Padilla was let go?
Those are personnel matters, and I think we understand how that works. But we're really lucky here that, as like Mike talked about, we don't have any burning platforms. We are super strong financially. There's nothing of malfeasance. There's nothing, ill towards the organization at all. It was just time for a change, and that was what happened.
And how many leaders are we looking at? The CEO, there's some other leadership positions open, aren't there?
The CEO will make those decisions when they come aboard.
A question for Mike. Just one of the things that can be difficult right now is obviously the nurse shortage and just finding doctors, not only here at Mosaic, but really kind of across the country. I guess, what is your importance with staffing and getting the right caretakers, whether that be nurses or really just across the board, in here to set you guys up for success?
Very good question, and the truth is the nursing shortage is national, and it has been, in my 30 plus years, I've never seen the shortage that we have today. So the answer to the question is meeting our staff, not just nurses, it's respiratory, radiology, it's all of these different departments. And it's not just St. Joseph, it's, in Albany and Maryville, being able to recruit and retain our staff is an immensely important thing that we're doing. So we need to meet our staff where they are. What are their needs? And they're going to have unique needs. We've got to, I call it mass customization. We need to come up with solutions that will recruit and retain staff, but we need to customize it to the needs. So it may be education for, one person, paying for education for one person, or providing mentorship for another. And those are all things that we will have to focus on. I've been doing a lot of reading in our industry and what are the things that we can do to work with their teams and the different generations. What's important to a millennial is different to a Gen Z or even the Gen Xers. And so, again, meeting our staff where they are and learning what we can do to support them and be the employer of choice. That's, I don't have to outrun the bear. I just have to outrun the guy next to me. And so the other hospitals and healthcare organizations that are recruiting, how can we be a step above them and be that employer of choice?
I only have time for one more question.
Mosaic has not only the St. Joseph Hospital, but also the hospital in Albany and Maryville. I guess, to you, how important is rural healthcare, and I guess what are some challenges that also provides being in a rural setting, not only for the hospital in St. Joseph, but the other two hospitals as well?
So it's immensely important. I started my career in a 32-bed rural hospital. I've had responsibilities for critical access hospitals and rural hospitals. The challenges that rural hospitals face are even more intense than more urban hospitals like St. Joseph. And I believe that they are important to the community because they're part of the fabric of that community, and they are being stressed everywhere. There are rural hospitals that are closing all over the country. And the fact that we are a system that we can support each other is important. And I think that you're seeing that across the country in healthcare, that there is more and more consolidation because you need that system to help support with the rural healthcare. But they're an important part of what we do, and they are part of our team. So I will be visiting those hospitals, and I actually have a trip coming up to Maryville this week, and I'll be in Albany also to understand, because they have unique needs, and we need as a system to meet those unique needs.